Hello folks, I'm Nikhil here from Mission Germany, and today we got Dr. Reddy from India. Dr. Reddy completed his medical studies in the year 2020, and he initiated the process, and he was there in Germany in 2021, and he got a temporary license in Germany in the early part of 2023. So Dr. Reddy has gone to the entire system where he had learned the languages in India, did the paperwork, landed in Germany, did the other requirements set forward and set forth by the medical council in Germany, went through the entire process and the challenges, successfully passed his FSP exam. Now he's working in Germany with the last 5, 7, 8 months of time. So I thought I'll take some insight from Doctor, because Dr. Reddy has completed his medical studies from a government college in India. So the first question for you, Doctor, is that as a doctor from a government college in India, why have you chosen Germany specifically for employment and specialization, sir?
In India, we don't have a choice to choose a specialization. We have to have a particular rank in the need to get a specialization. But in Germany, it's not merit based like in US and India. You can choose your specialty, like whichever one you want. You can choose radiology, orthopedics, and anything. So that's why I came to Germany to do my specialization, like whichever field I want.
So you are doing your temporary license. On a temporary license you are working. So once you get a permanent license, doctor, what specialization you are looking for yourself in Germany? What do you have?
I will be looking for neuroradiology.
Okay. Now, doctor, most of the doctors who are planning to go to Germany have got some specific questions that they keep always asking me. And I feel as a doctor who has gone through the entire process working on a temporary license, you will be the right doctor to give them an answer what you have felt. So I'll just be asking you some questions so that if you can just enlighten us. So one of the things which is usually asked by doctors that once we go to Germany, we learn the language in India, but how will you adapt yourself to the language barrier in Germany, and what strategy do you adopt so that you can communicate more effectively and efficiently with patients and the people in Germany? So how you prepare yourself in a better shape in Germany linguistically is the question, sir.
Like the language courses in Germany and which we have done in India will be very helpful. But other than that, like I have done volunteering here in certain like places which we can online, and the part-time job which we do here, and also the hospitation. The hospitation is like we can do it for a couple of weeks or 1 or 2 months in a particular hospital when we apply for it. So these three things, volunteering, part-time job, and hospitation, basically interacting with other Germans, it will be of utmost help, like more than the language courses or after the language courses.
So
That's when the language will pick it up to its level required.
Okay. So if I can summarize your statement, doctor, I can say that you do your language in India. That is basically a minimum prerequisite to complete your paperwork to come to Germany. When you are completing the other languages in the language institute, you're getting a feel of it. But as long as you don't interact with Germans with any medium, let you be doing some part-time job, doing some voluntary job, or doing hospitation, which gives you opportunity to interact with Germans as much as possible, will make you more effective and efficient in the language. Correct, no, doctor?
Yeah, the more we speak and the more we hear to Germans, the better the language will get.
I get it. This is very relevant. Now, one more thing which is usually asked, we from India have got a particular culture. Germans have got one other culture and all. So what cultural differences you found between Indian culture and the German culture, so as to speak, yeah?
Like the main problem will be with the food.
Okay.
You have to cook yourself if you want to eat Indian food. The Indian food outside is very costly, and the festivals and everything, like there will be Indians in Germany groups like in every big cities. So you can find this event dates and everything in the Facebook, and then you can go and join the events. But the main thing is food. When you can cook your own food and everything, then it will be okay.
So dramatic. If you see that there's no dramatic difference between culturally and all. German basically accept us. There's no racism there. What I meant to say.
Uh, like there is West Germany and East Germany. In
Yeah.
West Germany, like there is like no racism at all. Like people will accept you, like even if you are from other country. But East Germany, like uh, it's like some cities are good, some cities are like it's better not to like if you are that kind of person that it's okay for you how other people think about you or look at you, then you can work anywhere. But like if you want to work in a best environment, then either you have to work in cities or like in West Germany.
Okay, doctor. That will be helpful. Now, one more question which is usually asked by most of doctors is that what, in a nutshell, doctor, you see, do you know language is a challenge? But specifically, what are the other significant challenges you found in Germany? Because when you are in India, you see, we are basically running around documentation work to be set the right way, coordinating with the medical council, choosing the right state and the right medical council to do the paperwork and all. So these things usually are taken up by us, right? You as a student,
Yes.
you are trying to just align yourself, keeping in mind the suggestion, recommendation, the counseling done by us, right? Now, once you reach
Yeah.
Germany, as a doctor, you know language learning is a challenge. But excluding language learning, what are the other challenges you feel that a student should know before they go to Germany or reach in Germany?
One thing is the process, like people will take a lot of time to do our process, the documentation, like all offices, government offices will work very slow. And like if you have more contacts in Germany and know how to do the process, then the process will get quicker and you can avoid unnecessary delays in the process. That one thing I can suggest you.
Okay, rest everything all is good.
Yeah, like there is some delay, but if you have patience, you will get through it.
Right. So what I can always add to it, what I could figure out, doctor, is that you see, you reach Germany, you are all alone, right? We know that there are bureaucratic hurdles in Germany, the paperwork very slow. But if you
Yeah,
can socialize yourself, connect to people in Germany, create communities, be a part of the community, absorb and collect information from there, that can always be instrumental so that you can execute the same process in much more effective way. Because
yeah.
you can
You must have at least like 3 to 4 contacts, like who have done the process and who are doing the process currently
in that particular
Yeah,
location.
in that particular location, in the particular state. Then it will be much helpful, like for you to get to through the process and know the current situation. How is it? There is always like a Telegram group where like you can find like the people who are currently doing that process, like not only from India but also from other countries like foreign nations. There you will easily get the help and also like how to prepare for the exam and everything.
Okay.
So that's how you can find help.
Now, one more very relevant question which is asked by most of the doctor is what is the basic difference you feel? You see, you worked in India, doctor, before you went to Germany. And for the last 7, 8 months of time, I think you are working in Germany. You have worked before also, but on a temporary license, you are working for the last 7, 8 months. So, what basic major difference you find between the Indian medical system of working and the German system?
I have not worked in many hospitals in India. I worked in a small private hospital in India, like for 6 months or something, and I worked in government hospital, Gandhi. Like in compared to that, the quality here is very good, and also the time we work is also very less. I mean, we will work 8 hours per day. Like in the private hospital where I worked, it was like more like 10 to 12 hours a day, and the quality of treatment is like it's more and it's way improved, and also uh, the technological things which we use to treat the patient, and also the equipment, everything. It's like way more advanced than in India, I can say. But I don't know, like in huge private hospitals like Apollo and all those hospitals, I don't know how the equipment there will be, but in compared to a small private hospital where I worked and also the government hospital, it's way more advanced.
So, so Doctor, what I could summarize is that whatever challenges you are finding in India working in a hospital where your working hours are very extreme, you are paid a very meager amount, especially if you are working in the government part, sometimes you are very insecure about yourself because we don't know how the things will work around you when you are working in a hospital. And technologically, anyhow, we know how Indian, how the things are in India. So all these challenges, the work-life balance, the quality of life, the celebration and the feel of celebrating you being a doctor can be felt in Germany. Is this the right way of phrasing your statement?
Uh, the celebration of working as a doctor, I don't know about that, but it's like it's more relaxed environment, I can say, in
Work-life
general.
work-life balance is better.
Yeah, you'll also work only 5 days a week, and if you do a duty 24 hours duty, then you'll get a next day off. So it's more a relaxed environment.
Okay.
Hmm.
Now, one or two more questions, Doctor. I'll not take you much of your time. So overall, if you generalize the entire thing, how you feel about the German medical system as such? You feel it is good or still is very draining or something better can be done according to whatever experience you have gained? And what are your future plans?
Like in compared to India,
In a not you see that now you are in Germany, sir. I think keeping India the reference is now a history. In Germany,
yeah,
overall, how you feel about the medical system in Germany? You're happy with everything?
yeah, I'm happy with the German medical system. Like the work-life balance here is very good, and also the amount of salary that we get is also very sufficient, and we can also work as an emergency doctor and also like a family doctor, so we will have a different possibilities, and we can also learn many courses, and also the research possibilities are also more if you work in a city. So the learning possibilities are very huge, I can say, in Germany, and also the work-life balance is also very good.
And what are your future plans, doctor? Now you are in Germany, you're studying, you've got a temporary license. You want to stay in Germany or you plan to come back to India?
Uh, I like the environment and everything more in India, but till I do my post graduation, I'll be staying in Germany.
So
Post
you
graduation will usually last for 5 to 6 years. Till that, I'll stay in Germany and then I'll come back to India.
okay, that's so lovely. So overall, you don't regret the decision of you coming to Germany, what I can summarize.
No, I won't regret the decision of coming to Germany.
Now, the last question I want to ask you, doctor, you see, you have a lot of students having the same. You see, in the entire process, if you understand, paperwork, training and all in Germany, getting looking for an employment so that you're eligible to write the FSP exam, passing the FSP exam, right? So if you can explain us, doctor, about what was your experience in the FSP exam, what was the pattern of the FSP exam, and what phases were there in it, and how you managed it in a brief way so that we understand, because there are a lot of content on the internet that talks about what all things will be there, but when you have gone through it, so you can have your own experience shared with us.
So there are three parts in the exam. I had my exam at around 11:30. So when I went there, the first part is we have to take a case. There will be three doctors. One will act as a patient, other will be like evaluating how we perform and do the points, and the other doctor will be acting as a doctor. It's in the third step. In the first step, the doctor who acts as a patient, like we have to interact with the patient and we have to write about the case, and it will be for 20 minutes. And in the second part, we have to document what we have heard, like doctors documentation we have to do, like you guys will know. And in the third part, we have to present the case to the doctor who acts as a doctor. So it will be like it will last for 1 hour, and the main priority is given to language. In the third part, we will present the case and then they'll ask only like 2 to like couple of questions, like maximum 10 questions they'll ask, because the main emphasis is on language. And in other exam, the Cantonese proofing, they will ask many more questions because it's on knowledge, but this exam is mainly for language. So they'll see like how you are interacting with the patient, how grammatically right are you writing the documentation, and like how fluently are you presenting the case.
Okay.
So, and the result will be told at the end of the exam. Like on the same day, we'll know the result.
So bottom line, what I can say, doctor, ki as a doctor, if you are clinically confident about your capabilities, and if you to do good with the language, you do good practice in India, you go for good training in Germany, interact with people, look for avenues and resources so that you keep connected to Germans. As you rightly said about voluntary work or part-time job or hospitation, if you can improve your skill set in German language, and if you're clinically good, then passing FSP should not be a challenge, is what I can summarize.
Yeah, yes, Nikhilji.
Fine, doctor. You got a work permit and you're working from there. Any other specific suggestions you can give to doctors who are trying to come to Germany? If you have missed out telling me something, sir. And do tell me how much you're earning. We'll ask for a treat in India.
The most important thing is language. Like if you can do good language, then the process will be very easy. Like passing the exam and all the process will be very easy. But if you struggle with the language, then it will be a problem. Main thing is language here. And knowledge, like they won't go much deeper. They will ask only superficially. Even in the Cantonese proofing, which is the knowledge test, they will ask like not so much deep, and it'll be only like 1 hour exam or 1.5 hour exam. So the most important thing is language here. And right now I'm earning like without duties, I'll be earning 5,000 euros gross, and net it will be 3,000 euros. And like if I do like 4 duties a month, it will be around 6,500 euros gross per month, and the net will be around 4,000 euros.
Okay. And this is the standard slab for every doctor. It's not like you got it, but everybody doctor will be allowed, will be supposed to be paid the same amount. Or you got different.
It's same everywhere.
Okay.
Only like 100, 200 euros will be differing, but mostly it will be same. All over Germany it will be same.
Oh, good. Doctor, you have enlightened us so much. I'm grateful that you are connected with us. And I'm telling you, Doctor Sir, you don't know how excited I'm happy for you. And I'm eagerly waiting for India, hope so that I can meet you around 2-3 years of time. We haven't met for the last time when we went to Germany. I think the last 2 years we could not meet, but hope so this time when you're in India, we surely connect, sir. And as promised, that dance in your marriage is anyhow in the road.
Yeah.
Fine. This was lovely connecting with you, Doctor. You have a fantastic weekend, and I'll connect back again sometime whenever you are free.
Sure, Nikhil. Sure.
And I wish you all the best. Do good. Love you.
Bye.